Hello, this is Dr. Brad McCart, Northwest Surgery Center. And what I want to talk about today is what I mean by traditional foot surgery in general versus what we offer here at Northwest Surgery Center. Traditional foot surgery, when I reference that, what I mean is surgery done at a hospital or a large kind of surgical center, an ASC, really where it's a large facility. They do all different types of surgeries. You may have to valet or park your car in a big parking structure, find your way, crowded kind of rooms and waiting rooms. You fasted since the night before, so typically you're hungry before your procedure. Typically, you have to get cleared or optimized, meaning you get a chest x-ray, EKG, blood test, urine test, lab test, depending on what other medical conditions you have. You may be looking at getting put on medicines or taking off medicines if you're on blood thinners, or if you're diabetes, or if you have rheumatoid arthritis. A lot of hoops and jumps and other doctor visits even before you get your toe fixed. Then you show up several hours before your time. They give you an IV as if they to get you ready. When it's your time, the anesthesiologist will put medicine through there. Then they intubate you to keep you breathing throughout the case. And that's just the start of it all. At Northwest Surgery Center, it's more like, I always say sedation dentistry, going to the dentist, meaning I really just numb up your foot. We offer a couple things. We offer some medicine to help you relax, like Valium or lorazepam. And we also offer nitrous oxide, which is also referred to as laughing gas. That's really the first difference between kind of traditional bunion surgery versus surgery at our kind of boutique surgical center, Northwest Surgery Center. Typically for traditional surgery, once you're in the operating room, the doctor will exsanguinate and remove any kind of blood they can out of your foot, then inflate a tourniquet so there's no bleeding with that large incision, so you don't bleed out and the doctor can see what they're doing. Typically there's about a 7-centimeter incision over the top of your foot. There's hundreds of ways of fixing a bunion, but the doctor will pick which one they want. Typically involves removing the bone, breaking the bone, which is a fancy word, osteotomy, or fusing the joint, basically removing the space between two bones and connecting them. Most of these procedures, the doctor will put in wires, screws, plates and screws or staples. Typically then they do a layered closure. Since they open up several layers to get down to bone, they'll do a layered closure, sometimes staples at the end. Then you have a bandage with an AO splint, a cast or a cast boot, most commonly a cam walker, which is a removable boot that goes up your leg just below your knee with Velcro straps. And then they send you to the recovery room where they wake you up, make sure that you're stable before discharge, which they'll remove the IV and go through physical therapy training with you. For us at Northwest Surgery Center, once you're in the operating room, you're awake. You get to pick the song that you want to listen to. We typically get to know each other. We talk about different trips and the weather and family. Procedure itself typically takes about half an hour. What I do is I typically make 3 small incisions about 2 millimeters long. Through those incisions, I sneak in, I remove some bone. I may make a small cut in the bone and shift it over. I'll balance the tendons or the ligaments so everything sits good. There's no plates or screws or wires, anything temporary or permanent that goes in your foot. There's a small bandage that I put on at the end over the front half of your foot. And then you walk out in a small post-op shoe. We'll spend about 15 minutes in recovery, icing your foot and going through the instructions. And then you can either drive yourself home or catch a ride with one of your friends or family members. So traditional surgery, typically there's a period of non-weight bearing where you stay off your foot and you have a cast boot on. The doctor may let you walk on it in the cast boot, or they may tell you to stay off of it for 4 to 6 weeks, sometimes 3 months. In that case, you have a crutches, knee scooter, walker, to roll around in. Typically, there's weekly dressing changes or cast changes, and sometimes there's a pain pump. Sometimes there's a catheter that comes out 3 days after the surgery. Typically, you have some type of narcotic medicine or over-the-counter medicines to take for pain, and regular visits for that time while you have the cast on. As far as following that, there may be a period of physical therapy 3 to 6 months after. For us, typically you walk out, depending on what bunion procedure I pick. If we just remove some bone, you may be in a bandage for 1 week. If we remove some bone and make a small cut in the proximal phalanx, often referred to as an Aiken osteotomy, there may be a bandage for 2 weeks. And then if we do more of a metatarsal osteotomy, there may be a bandage for 4 weeks. Depending on how far away you live, patients that live closer in Wisconsin, they like to come about once a week. We change those bandages. You got to keep them dry. Most people get a shower bag, which slides over your ankle so you can shower without getting it wet. And we give you that small post-op shoe to walk around or drive in. Typically, during the healing process, most people take Advil or Tylenol. Icing and elevating tend to work the best, but some patients also like to have narcotics like Tylenol with codeine or Tramadol, Vicodin, or Percocet. But that is typically the post-op period. There's no wires that get pulled out. Ultimately, there's no screws or anything in your foot. So after about 4 weeks, if we do a larger bunion correction, you're in tennis shoes, and you really start ramping your activities, we typically give you home exercises at that visit.